Good morning, viewers. Welcome to an episode of NK's Conversations. This time it's a conversation with Dr. Rashmi Kundapur. She's a professor of community medicine at the K.S. Hegde Medical Academy in Mangalore. And we are going to talk about something that will interest all of you. We are all fearful of the COVID-19 virus. That is natural because nobody likes to get sick, first of all, and nobody likes to get acutely sick. That's the second part of it. And the fatality, obviously nobody wants to hear about it also. Important part is what does happen when you actually get sick. There are three parts to it. The first part, of course, is when you are symptomatic but not yet tested positive. Now you have a fever and a cough. The second part is, let's say you are asymptomatic but you have tested positive. And the third part, of course, is when you are symptomatic and you have tested positive and you are in hospital. I wanted to talk to Dr. Rashmi Kundapur about what are the treatment protocols that we are likely to encounter in these three cases. Dr. Rashmi.
Before I start on your question, the first thing what I would want to say is the whole part of the system is we should learn to live with COVID-19. That's the first thing. All of us have to accept that. We have to start living with it. There is no need of being panic, or the panicity has nothing to do with the treatment or with the positivity. And looking into the fatality, truly speaking, nowhere in the world it has increased more than 2%. Anywhere in the world it has not increased more than 2%. India, being supposed to be the young population by its, because we have a median age of 27, the expected fatality is between 1.2 to 1.5% only. So if you're going to increase the fatality, we will be increasing it by 2% or 1.2 to 5%, not more than 2%. What is happening is because of the numbers, we are really scared. Again, second thing, all of us know that, I think by now most of us know, and it's been proven to see that except for the rare cases, most of the things when we look into the death is more common with lot of comorbidities and elderly. And everywhere in the world it is the same. India is not different from that. And in India, more of the young people, like we expected, because most of them are the young population, we expected young are more healthy, nothing much to be done, though they are positive. Why the world is running behind the numbers, I have no answer. And yes, I agree that infectivity of COVID-19 is very high as compared to any other infectious disease. Maybe SARS, maybe MERS, whatever. But remember, SARS has 9 to 10% fatality as compared to this is 2%. MERS had higher fatality, like the rate was very high. The infectivity is very high here. Infectivity is like lower because they come only when there was symptom, they would get infected. Whereas here, without even symptoms, others may get infected. So that's the only fear factor which is. But first thing I would want to tell very clearly is the more difficult and more problem is fear of unknown is killing us. This is the whole concept of fear of unknown. It's an unknown concept as such. Now coming to the treatment, as such, if you will, there is again a fear of unknown. Why I started with that is the fear of unknown. None of the treatment as such. If you look into COVID-19 is one of the coronavirus, and corona, multiple other corona have been infecting, like SARS it is, but there are other simpler corona like common cold which gets infected in many of the Indian population, especially in Indian population. So for common cold, do we take any specific treatment? No. It's the same thing unless and until there is a comorbidity, unless and until it gets secondary infection. So in this also, most of the time it is self-limiting. If you look into even in the Dakshina Kannada in Mangalore or many other places, lot of people who are positive have been positive because you went and tested them and they did not have much of, like first question you asked with symptoms, cough and fever. This is a common symptom of majority of ILI, influenza-like illness, and there may be severe acute respiratory illness which can occur due to many other along with COVID-19. So all that will have a same protocol. If it is ILI, they will have a criteria to look into whether the ILI, we are testing COVID for ILI because we are suspecting it can be one, but it also will be with other testing will be done. So specific ILI will be given. If it is a viral ILI, nothing much except for the substitute this will be given. And if it is bacterial ILI, there will be specific antibiotic given for that. So it will be tested only for COVID positive or negative because we should not miss COVID in the ILI. That's all the reason is. So there is no specific with ILI and SARI and not positive. That means they will go into other ILI and SARI. Like we used to have ILI, influenza-like illness, and SARI like earlier, and the treatment used to regularly go as it is for the specific one. SARI most of the time needs a lot of admissions and a lot of other treatment protocol which has to go, and each infection has its own protocol that will be followed depending upon what is it. This is only to rule out in fever and cough, whatever you said, and like not positive, it's only to rule out COVID. I am not into the debate now to say why are we running behind numbers. I am not into that. But basically, because as a doctor, we look into, because we do not want the high infectivity into the hospital or into the community, we are ruling out COVID in all of the ILI and SARS. So there is no specific treatment as such, except for you build the immunity like any other ILI, try to build immunity and get that. That is one. Coming up to the second one, what you said, when they are asymptomatic and positive. Most of the young and majority of the people are like that, where you can see other than. And when we go into that, except few, see every state and every person have developed its own one. The government of India has given yes for certain drugs, and which is also being carried out. But again, see, there is a lot of, again, I said fear of unknown. There is a lot of controversies. There is a lot of debate. There is a lot of acceptance and non-acceptance. And if you look into COVID-19, most of the time is a self-limiting disease. What are we going to do with the treatment is we are reducing the high infectivity and also we are reducing it going for severity. So we'll reduce the lung. And basically HCQ, so chloroquine, which has been a top, is been given because it is an immunomodulator. It increases the self-immunity to develop a self. It works as an immunomodulator in many of the diseases. So that was also taken into consideration and they have tried it. And now again, there is no fully equipped clinical trial for that. So that has been in India given as a prophylaxis for the vulnerable who are working as healthcare workers. Not for everybody, unless and until it has been prescribed, not for everybody as a prophylaxis. So most of the asymptomatic will not be given anything unless and until it is at a need. Those will be given the prophylaxis of HCQs. That is chloroquine and or HCQ will be given. That is being given only when the doctors looks into the certain people and they feel that, okay, this person needs it because they have so many underlying which has to be given. Not for everybody. And it is not necessary to be given because most of the time they are asymptomatic. See, we may have people with just few sneezes and they may be COVID positive. So nothing to be done, just observe them.
Okay.
So that is how it is. Then like look into whether they are going into any of the severity or any of whether they are going into, whether they need to go. Now, there are symptoms also like what you say that is like fever or that. It again remains the same, like common cold. Some may require some part of a treatment, some may not require, even with a fever or cough with COVID positive. Like it's a simple, if it's high, it's not reducing after so many things and very high fever, or there is lung capacity, there is breathlessness, the person is having, then you give a lot of oxygen therapy, more than the treatment as an oxygen therapy. We do not want the lung parenchyma to be reduced. There are 3 ways how the treatment is given all over the world. Even in India, in certain parts, certain things are being given. That is one people do with HCQs, that I said is prophylaxis. Some of them give as a treatment going to severe as HCQs with azithromycin. Even AIMS have tried that. But again, I say we do not have so much of sample people to do a clinical trial and who was running clinical trial and get a full proof. but it has been tried, and they say that it is without anything, something is better. Something has been worked out better. So HCQs with azithromycin has been tried in AIIMS also and many other places. And antiviral, remdesivir and many other antivirals have been also tried. In Rajasthan, they have tried in many things, they have been tried. See, these are all depending upon the patient's, how the condition are. The respective doctors will decide on whether. So there is no standard protocol as such. This has to be given for COVID positive patients. Depends upon the severity, depends upon the patient's other features and how they are going forward, like vulnerability, they are infected, like diabetes. And more important is, I would want to say is, your comorbidities are one thing. That is your diabetes, hypertension, and your lung capacity. So if your diabetes is uncontrolled, if your hypertension is uncontrolled, if your lung capacity is compromised, then the issue comes of severity. And then the issue comes about lot of these drugs coming into picture. Most of the time it is not required, and of course some of the things they give required to give because they may suspect that they may go into very severe, so that has been given. So as a standard SOP, standard operating protocol, there is nothing like this has been given. Everything is being tried out, and these have got the approval from the DGS, that is from the Director General for drug to be given with prescription depending upon the patient's condition. Again, they are not to prevent COVID-19, nor they will, like, curing it will cure by itself. It will only prevent you from going into high severity, and instead of running longer, the suffering will run shorter.
Once you start, let's say you're a little severe and you're in hospital. Once you start the treatment, how long does it really take? Of course, there could be a fatality, but otherwise, coming out of it, how long does it take generally?
Yes, generally, see, the whole part works out to be around the disease by say is for, like we say, it runs peak between 7 to 14 days. 7 to 12 days or 14 days is the peak where it more commonly happens as a peak. Infectivity rate is very high. We have seen even after 21 days, some of them have got into severity. So that's what I'm saying. That's a quiet, unknown disease by itself. That is the fear most of the doctors and most of them have, because we do not have a natural history of the disease. A natural history of a disease is done, we are very clear. And this disease still now, because it's like for you all, it may feel it is longer. But if if we look into the epidemiological point of view, this is still a baby disease. It's just come in December. I understand the natural history after years together of the disease. If you look into a lot of diseases, including plague. So it takes time.
But by the time we really understand it, it might mutate. It's quite possible.
Yes, it might mutate. It has been mutating also twice or thrice. And that is the major thing of most of influenza virus, if you see. That's how even US had a lot of influenza coming up and they keep mutating. That's how the influenza viruses are. But if you mutate also, the natural history may little change. It will not totally change. So that's because of the mutation only we are having a natural history. There are different strains in that which give us a different natural history which we have seen. But to understand a natural history, we require a little more time to say, like we know it on properly it's a standing, but exactly this happens, because every day, if you see, there was a need of ventilators. Quite earlier they said we have to hype up on ventilators. Right now US says ventilators are of no use, but only oxygen, and only oxygen is required at the period of time. There are multiple people saying it looks like an high altitude disease. So we are not yet clear, like whether it is an ARDS, that is acute respiratory distress syndrome, or it is like high altitude like options. So we require only oxygen, but oxygen requirement everybody speaks about, but we do not know. And again, everybody speaks about, because there is a comorbidity, imagine. So there is a damage in the immune system, which causes, and this infects the lung. So it infects more. This is a common one, this we know. But how it infects, what it does exactly, needs some more time to identify. And it is spreading it like so very fast, so many things. Like people to work on it also, it's taking a lot of time to understand. So that's the one in the treatment also will become.
That brings me to my next question. We have heard a lot about this herd immunity. Can you just tell us what that is and whether it's possible that we can get immune from this virus through that?
Yes, definitely. I believe like one of the, my teacher is Dr. JP Mulyal, who is one of the India's renowned epidemiologist and all over the world. And I, even when Sir came up with the first interview, even before that, because he was my teacher, I believed that herd immunity, because even for SARS, even for H1N1, all these pandemic, herd immunity was the answer. So for any virus, herd immunity is the answer. Now you may question me why UK failed. UK failed in many of the things initially, but later they went on doing it better because they didn't do certain. Herd immunity is not like you just go and say, okay, come, hit me. It's not in that way you should go. You should go in a very staggered manner to get. And for answer, either vaccine or herd immunity are the only two answers we have for any virus. Either it is vaccine or herd immunity. And taking into for COVID-19, according to we looked into the diamond ship. That was the one best example where they looked, everybody who was naive could get an infection. And that is the best one to take. The R0 was 2.8. According to that, if you go back, if 55% of a population gets infected, you get an herd immunity. Some people say 80% and all, but diamond ship is the one where everywhere were vulnerable and nobody had immunity. And when we looked into that picture, that it is 2.8, that means 55%, which comes up to, that is the statistical methods, how you do, and 55%. And remember, in all the 55%, all will be not vulnerable for death, because there will be 85% of mild cases. And so many of them asymptomatic, you will not even know. And even if you have, in that 50% will be asymptomatic, 50% will be mild cases, 15% will be severe, and you may have maximum of 2%. But that is the answer. But how we are going towards herd immunity makes a lot of differences. There is where you have to have a staggered way to approach towards immunity. You can't just go and stand in front of it, because numbers increase. If you look into the population, total number at one time will increase. Though you may not have enough people to give it into the hospital. That is the reason what we are talking.
I want to ask you a layman's question. When the virus spreads, as it spreads to more and more people, does it diminish in its intensity?
There are 2-3 things. See, one thing is, it does not diminish in its intensity. That is how we have seen. See, I'll answer it as in a layman answer only. If you look into, when there is an herd immunity develop, for example, it will spread from me to the next person who is immune. Then it will spread to other person who is again immune. And then third person, fourth or fifth time, the virus will get confused. Something is going wrong. So it will either die or it will just leave the whole space. That's not the scientific answer, but layman type of answer, if there is an herd immunity to answer that. So that's the...
Yeah, that's what I think that's what people wanted to hear. That's why I asked you the question.
That's how it is. So it gets like, okay, it gets totally confused where I'm going, what is happening. So that's how, like in a layman question, that's how herd immunity works. Like if I am immune, 5 members, the 6th person, instead of going 6th person who may be possible to get an infection, that is why we say the elders have to be saved right now. So you mean to say every time they'll stay at home, they may. What happens when herd immunity develops? When the youngsters have more of herd immunity, by the time it goes to the old person, then it may get confused and it may just leave off, like it will not be present at all. So those are the things. Well, that is what happened even in the polio, if you look into, that is how. But polio had to have lot of vaccination, 85% vaccination to get herd immunity. This is like 55, little better off if you look into compared to all those.
So I'm now coming back to that last point you made, vaccination. COVID-19, everybody's looking at a vaccine to finish it off, and also they're looking at new drugs to be treated with, so that they don't have to worry about even if they get the disease. These are two things that people are thinking about. Can you just highlight where we stand on all this?
This one, I think the first one I would congratulate was DD had a few days back, few days means around a month back, had done with Dr. Soumya Swaminathan, who was a scientist, Indian scientist in WHO, Dr. Soumya Swaminathan, and a microbiologist by herself. And a lot of us believe, like along with her, there is already a vaccine running, but very truly all of us have to agree on minimum 1 year is a requirement for any vaccine to be developed. So till December, we cannot expect, whoever claims whatever, to get all the clearance or whatever it is, till December, we cannot expect to have a vaccine. That is one thing. And in that, again, Dr. Soumya Swaminathan said, once the vaccine is developed, also remember it will be very highly costly, which most of the developed countries will procure rather than a developing countries like ours can procure. So probably we will be in the second line rather than the first line who can procure the vaccine. So that is what we always said. The social vaccine is already available. That is distancing, the mask, keeping your distancing, hand washing, which is the social vaccine which has to. Coming up to the drug, I said right now, there are again trials going on with the major things. Even in UK, they are doing it. But remember, there is a problem with the whole thing is you have to have when you are having a clinical trial, the other factors should be same. So one is given drug and one is not given. Now in this state, to happen that way is going to be very, very difficult because of infectivity and people with all anxiety and so many things happening. But one standard clinical trials are happening with numbers, probably with large numbers right now. Because see, imagine severity is very less. Only those people will get into and we have to look into. So when we look at that, it may take probably another 2-3 months for an answer to come what could be the exact drug. That is how we had 2-3 months. We came to know that it is not necessary everybody have to undergo ventilators. So that is how we took. So similarly, maybe in another 2-3-4 months, we may come to say what can be the drug to reduce the severity. It will not be for the treatment. Again, I said it's a self-limiting disease. Only thing what we are going to say is what could be to reduce the severity. So save the most, like possible savable people can be saved. Now again, I'm saying possible savable people can be saved. Unless there is a herd immunity and vaccination, we cannot save 100% in any viral disease. Possible savable people can be saved from the severity whenever we give into as a drug. Like what we are doing it with HIV. Right now we have drugs, we do. So possible their longevity is increased. They can live as much as long with the, like a lawn. Doesn't mean that they will be totally like normal. But they can live normal as much as possible. We are increasing their quality of life, increasing their longevity. That can happen. Here, it is not longevity because it is only severity reduction possible. This can happen maybe another 2-3 months. We can get an answer for what could be the exact, because now each country is claiming this is better, this is better. So another 2-3 months, probably the answers, because everybody is sending their findings to WHO and various international agencies. It will be looked into. Other scientists will work on that. So they look into, and then probably we have also extracted the virus. So using the virus on the virus extract, using the drugs may give better answer. Now all the studies, research takes quite long time. So we have to wait for 2-3 months probably.
So the exit strategy, as I can see it, is that we gradually exit the lockdown and then develop a herd immunity for the time being. And hope for the drugs and the vaccine to be formulated in the near future.
Formulated as soon as possible.
As soon as possible. And one last concluding question, Doctor. The deaths in Europe, Italy, Spain and Germany, and in the UK for that matter, are very high compared to even what we have or probably what even the US has. Do you have any explanation for that?
UK is very well known. We actually knew. UK is the oldest population if you look into. Oldest population means I'm talking about the median age. Okay. In the world, UK has the oldest population, that is the median age of the people is, that is why I said we are the young population. Our median age is 27. Though we have a sizable number of old people, ours is a young population by and large. They have an oldest generation, oldest people. And if you look into, when you look at the US has the best example to look into, if you look into smoking wherever, and that is a cold region, so there is a lot of smoking happening, and smoking is like giving a lot of because it affects the lung, and COVID also affects the lung, causes a lot of mortality. Even US studies have seen, UK studies have seen that. So that are the two reasons to have high mortality in UK. And also I said, like if you look into, they did not, they were in that concept of, you remember the chickenpox parties? So they were in that concept. Chickenpox infectivity is totally different and this was different, but they were in that concept making like we will have herd immunity in that way. So that was their one strategy, which was not very true to start off with, whereas India had done much better in that. I also sometimes agree with the Spain. They say it reaches the peak. Like if you look into the death overall will remain the same. Only thing is they got it at early. Over the period, other countries also will get, we will come down the peak much earlier than the other country. That's what the epidemiologists of Spain are saying. And it looks like that also if you look into it.
Yes.
So the death remains the same as a number, but it may be early now. And when we look at the other countries, later you will see that death which will not occur in our country. And I also, if you look into the way how it is happening in Spain, it looks what they're saying is true. It may happen the same way. And what we are seeing right now in India is also like how we are looking at the things. It may work out the same. No, we couldn't be like Spain because they had high number of infrastructure. They could save as all the savable were saved. Only the numbers, because we will not be able to do that. We will go to the Italy state. So we had to do this. Italy again did not have a preparedness. That was the major thing, and the savable were not saved in Italy. They didn't have a preparedness. From all this one report, they say it's not very high. Again, they say COPD rate was very high in Italy. COPD is chronic obstructive pulmonary disease, which was very high in Italy. That was one of the reasons which gave them to have more death. But again, those things, and they were also did not have preparedness. They decided that it will all, because we are very good, we will manage everything. And unknown was taken granted. See, we have one side, we have fear of unknown, and one side where people were overconfident. So both the things are bad. So there is a requirement to both the things to be actually looked into.
So that proves the maxim that the known devil is better than the unknown devil.
Yes, definitely.
Thank you very much, Dr. Rashmi, for joining me. It has been very illuminating, the discussion, not only for me personally, but I'm sure for our viewers. Thank you very much for joining me on this show.
Thank you.